Let me ask you something most men have never actually learned, despite how much it affects their relationships. What actually creates a genuine sense of connection during intimacy, biologically and psychologically, versus what just feels like going through the motions? Most men assume this comes down to technique alone, something mechanical you either know or don't. But in my years as a urologist working closely with men's health and the physiology behind intimacy, I've come to understand that the deepest, most consistently reported satisfaction between partners has far less to do with any specific physical technique and far more to do with a handful of biological and psychological principles almost nobody explains clearly. I'm Dr. Emily Carter, and today I want to walk you through what the research actually shows about connection during intimacy, the neurochemistry involved, the psychological conditions that consistently produce a deeper experience for both partners, and what most men are missing that has nothing to do with physical skill. Before we get into it, if this kind of honest, clinically grounded conversation about men's health and relationships is what you've been looking for, hit subscribe and drop a comment letting me know you're here. Let's get into it. Here's the first thing worth correcting, because it shapes everything that follows. Most men approach intimacy thinking primarily in terms of physical mechanics, the right movement, the right timing, the right sequence of actions. And while physical comfort obviously matters, the research on what actually produces a sense of deep connection and satisfaction points somewhere else almost entirely: the nervous system, and specifically whether it's in a state that allows genuine arousal and bonding to occur at all. I had a patient, mid-50s, married many years, who came in somewhat frustrated, describing his intimate life with his wife as functional but flat. He'd read extensively about technique, tried adjusting all kinds of physical variables, and nothing seemed to meaningfully change the experience for either of them. When we talked through what was actually happening in those moments, emotionally and psychologically, it became clear the issue wasn't technical at all. It was pace, presence, and an absence of the specific conditions that allow the body's natural bonding chemistry to activate. Once he understood the biology behind what was missing and adjusted accordingly, both he and his wife reported a meaningfully different experience within weeks, without changing any specific physical technique at all. To understand why this happens, you have to understand a basic piece of physiology that applies to both partners, though it's often discussed specifically in relation to women's arousal, since the sequence is more externally visible and has been more extensively studied. Genuine arousal and connection depend on the parasympathetic nervous system, the branch of the nervous system responsible for rest, safety, and openness, being active rather than its counterpart, the sympathetic nervous system which governs stress and alertness. When someone feels rushed, anxious, distracted, or not fully safe and present, the sympathetic nervous system remains at least partially engaged, and this directly interferes with the physiological processes that produce a fuller, more connected experience. This isn't abstract psychology, it's measurable physiology. Blood flow patterns, hormone release, and tissue response all differ meaningfully depending on which branch of the nervous system is dominant in that moment. A rushed, anxious encounter and an unhurried, emotionally present one are quite literally different physiological events, even if the physical actions involved look similar from the outside. This is where a lot of men unknowingly work against themselves. Genuine arousal, particularly in longer-term partners and particularly as both partners age, is not something that can be rushed without real physiological consequences that both people feel, even if neither can quite articulate why. For women specifically, research on arousal physiology shows that the full sequence, increased blood flow, tissue changes, natural lubrication, and the muscular changes that allow for comfortable, connected intimacy typically takes a meaningful amount of unhurried time to complete. Rushing this process doesn't just reduce comfort. It measurably reduces the depth of the experience, because several of these physiological changes simply haven't finished occurring yet. For men, patience carries its own version of this principle. Anxiety, particularly performance-related anxiety, activates that same sympathetic stress response we just discussed, which can directly interfere with the physical responses needed for a fulfilling experience. This creates an unfortunate cycle. Worry about performance triggers a stress response that worsens performance, which increases worry further. Understanding this cycle and consciously working to slow down and stay present rather than rushing toward an outcome breaks that cycle more effectively than almost any specific technique could. Now, here's the piece I think explains more about what men actually experience as connection than anything else in this conversation: the role of oxytocin. Oxytocin, often called the bonding hormone, is released in both partners during intimate physical contact, and its release is significantly amplified under specific conditions: genuine emotional safety, unhurried presence, and authentic mutual attention rather than distraction or performance-focused anxiety. This isn't a vague feel-good concept. It's a measurable neurochemical event that produces a specific physiological and emotional state, a sense of being genuinely met by another person, of closeness that feels both physical and emotional simultaneously. This explains something most men have felt without ever having language for it: the noticeable difference between an encounter that felt deeply connecting and one that, while physically similar, felt comparatively empty or forgettable. That difference is not imagined, it's chemistry, and it's directly tied to the conditions we've been discussing: presence, safety, and unhurried, genuine attention, rather than any specific physical technique. I want to take a moment here because this connects to something central to how I think about men's health more broadly. So much of what actually improves outcomes in this area, and frankly in most areas of men's health past 40, comes down to understanding your body's actual physiology rather than chasing surface-level fixes. That's exactly the philosophy behind a complete resource I put together called the Iron Age. It covers testosterone, sleep, strength, stress, prostate health, and yes, the physiology of intimacy and connection, all as part of one interconnected picture, with a clear, practical protocol for each piece. For $49.99, it's less than the cost of a single specialist visit, and it's something you'll be able to reference for years as your body continues to change. If these videos have been useful to you, I genuinely encourage you to take a look. The link is below. Now, back to what actually drives that sense of connection. Something that gets treated as a soft secondary consideration, open communication between partners, actually functions as a direct physiological lever, not simply good relationship advice in the abstract. Research on couples consistently shows that partners who communicate openly about preferences, comfort, and pacing report meaningfully higher satisfaction than couples who avoid the topic and rely on guesswork or assumption. This makes sense once you understand the nervous system piece we discussed earlier. Uncertainty and unspoken assumption create a low-grade background tension, which keeps the sympathetic nervous system at least partially engaged, working directly against the safety and presence needed for a fuller experience. Simple, direct communication. What feels good, what doesn't, what pace feels right in the moment, isn't a clinical or awkward add-on to intimacy. It's one of the more effective tools available for actually producing the physiological conditions we've been discussing throughout this video. Couples who treat this as a normal, ongoing conversation rather than an uncomfortable topic to avoid consistently report both greater satisfaction and greater emotional closeness over time. If I had to distill everything in this video into a single unifying principle, it would be this: emotional safety is not a nice supplementary feature of intimacy. It is the actual physiological foundation everything else depends on. A partner who feels genuinely safe, genuinely desired, rather than simply needed, and genuinely free from judgment or pressure, experiences measurably different physiological responses than a partner navigating any degree of anxiety, distraction, or uncertainty. This applies to both partners, though. It's been studied more extensively in women specifically, given how directly it's tied to the visible physiological arousal sequence for men. This means that qualities like genuine attentiveness, patience, and emotional presence are not simply thoughtful relationship behaviors layered on top of the physical experience. They are directly biologically responsible for producing a more connected, more satisfying experience for both people involved. This is worth sitting with because it reframes the entire question most men start with. It's rarely about learning a new physical technique. It's about creating the physiological and emotional conditions under which connection can actually occur. So what does this actually look like in practice? A few consistent themes emerge from the research and from what I've observed clinically over the years: slowing down genuinely, rather than treating any part of intimacy as a task to move through efficiently, allows the physiological processes we've discussed to actually complete rather than being rushed past. Direct ongoing communication rather than assumption or guesswork removes the background uncertainty that interferes with genuine presence. Managing your own anxiety, whether that's performance-related worry or general stress carried in from elsewhere in life, matters enormously, since that anxiety is physiologically incompatible with the state needed for genuine connection, and consistently prioritizing your partner's comfort and experience as equally important to your own, rather than as a secondary consideration, creates the emotional safety that the entire process depends on. None of this requires any specific technique or expertise. It requires understanding what's actually happening physiologically and being willing to slow down and prioritize presence over performance. Before I get into the more practical pieces, I think it's worth pausing on why this information gap exists in the first place, because understanding that helps explain why so many men reach their 40s, 50s, and 60s without ever having a clear picture of what we've discussed so far. Most men's early education on this topic, if it existed at all, came from incomplete, informal sources, friends, media, assumption, rather than anything resembling accurate physiological information. The emphasis, culturally, has almost always been on physical performance and technique because that's the visible, measurable, easily discussed piece. The nervous system, the hormonal environment, the psychological conditions required for genuine connection, none of that fits neatly into the kind of conversation men were culturally permitted to have about this topic, if they were permitted to have one at all. This creates a strange gap where men can be, by every external measure, experienced and capable, while still missing the actual physiological principles that determine whether an experience feels deeply connecting or simply functional. I see this constantly in my practice. Men in their 50s and 60s, in long, otherwise healthy relationships, describing a sense that something is missing without being able to articulate what, simply because nobody ever gave them the language or the biological framework to understand what they were actually noticing. I want to draw out a distinction that I think clarifies a lot of what we've discussed, because arousal and connection, while related, are not the same physiological event, and conflating them is part of why this topic gets misunderstood so often. Arousal in a narrow physiological sense can occur without deep emotional connection. It's a vascular and nervous system response that can be triggered by a range of stimuli, with or without the emotional safety and presence we've discussed. Connection, on the other hand, specifically depends on that oxytocin-driven bonding response, which requires the additional conditions of safety, presence, and genuine mutual attention layered on top of basic arousal. This is precisely why two encounters can be physically similar and yet feel entirely different afterward. One activates the baseline arousal response alone. The other activates arousal alongside the full bonding chemistry, producing that deeper sense of closeness and satisfaction. Understanding this distinction helps explain why simply focusing on physical technique alone, without addressing the psychological and relational conditions around it, tends to produce a plateau in satisfaction that no amount of technical adjustment resolves. Something that rarely gets connected to this topic directly, but absolutely should, is the impact of general life stress, work, finances, health concerns on a couple's capacity for genuine connection during intimate moments. We've established that the parasympathetic nervous system, the state of safety and openness, needs to be dominant for the fuller physiological and emotional experience to occur. Chronic background stress from completely unrelated areas of life keeps the sympathetic nervous system, the stress response, partially activated even during moments meant for connection and closeness. This means a couple can do everything right in the moment itself, communicate openly, slow down, prioritize each other's comfort, and still find the experience feels somewhat flat if one or both partners are carrying significant unaddressed stress from elsewhere. I've had patients where the actual intervention that improved their intimate relationship most significantly wasn't anything specific to the bedroom at all. It was addressing chronic work stress, improving sleep, or working through an unrelated anxiety that had been quietly keeping their nervous system on alert for months. This is a pattern worth understanding because it means the principles discussed throughout this video don't exist in isolation. They're deeply connected to the broader picture of stress management, sleep, and overall nervous system health that I discuss across many of my videos on this channel. I also want to address how these principles shift, and in some ways become more important rather than less, as couples age together. For women, hormonal changes associated with menopause and the years surrounding it often mean the physiological arousal sequence requires more time and more deliberate, unhurried presence than it may have required decades earlier. This isn't a decline to be concerned about. It's a normal physiological shift that simply requires the same principles we've discussed: patience, presence, communication, applied with even greater consistency than before. For men, age-related changes in testosterone, cardiovascular function, and nervous system responsiveness mean that performance anxiety, if left unaddressed, has a more pronounced physiological impact than it may have had at a younger age, since the margin for the stress response to interfere with function narrows somewhat over time. This is precisely why the psychological principles discussed throughout this video, managing anxiety, prioritizing presence over performance, become more rather than less important as men age, even though the cultural conversation tends to focus almost entirely on younger men when discussing this topic at all. Couples who understand these shifts as normal, expected physiological changes, rather than signs that something has gone wrong, consistently navigate this stage of their relationship with considerably less frustration and considerably more satisfaction than couples who interpret these changes as a problem, requiring some kind of return to how thin I've used the word presence throughout this video, and I want to define it more concretely because it's easy to treat as a vague, abstract concept rather than something specific and practical. Presence in this context means genuine, undistracted attention on your partner and the shared moment, rather than attention split between the moment itself and unrelated thoughts, whether that's work stress, a mental to-do list, or self-conscious monitoring of your own performance. This last piece is worth emphasizing specifically because a significant number of men, without realizing it, spend intimate moments partially monitoring themselves, evaluating their own performance in real time rather than being genuinely present with their partner. This self-monitoring is itself a form of the sympathetic stress response we've discussed, and it directly interferes with the depth of connection possible in that moment, even though the intention behind it, wanting to perform well, comes from a caring place. The paradox worth understanding here is that letting go of that self-monitoring and trusting the process rather than actively managing it tends to produce better outcomes on every level, physical and emotional, than the vigilant self-management most men default to. This is genuinely counterintuitive for a lot of men who are used to approaching challenges by actively managing and optimizing them. Here, the more effective approach is closer to the opposite, releasing that active management in favor of genuine presence. I want to close this section with a broader point about how to actually apply everything we've discussed, because I think there's a temptation to treat this as a one-time adjustment rather than an ongoing practice. The couples who maintain the deepest sense of connection over years and decades aren't the ones who found some permanent fix at a single point in time. They're the ones who treat communication, presence, and mutual attentiveness as an ongoing practice that evolves as both partners age, as life circumstances change, and as new stressors or health changes emerge. This mirrors almost everything else I discuss in this channel about health more broadly: sleep, strength, stress management. None of these are one-time fixes either. They're ongoing practices that require consistent attention rather than a single intervention. I'd encourage you, if anything in this video resonated, to treat it as the beginning of an ongoing conversation with your partner rather than a single insight to apply once and set aside. Check in periodically, ask directly about comfort pacing and what's working or not working, rather than assuming that what worked years ago still applies exactly the same way now. Bodies change, circumstances change, and the couples who adapt this conversation alongside those changes are consistently the ones who report the deepest, most lasting satisfaction. I also think it's worth directly addressing the role media portrayals play in setting unrealistic expectations around this entire topic, because I see the downstream effects of this constantly in my practice. Much of what men are exposed to, whether through entertainment media or informal conversation, presents an unrealistic picture, emphasizing speed, intensity, and physical performance almost exclusively, while almost entirely omitting the nervous system, emotional safety, and communication principles we've spent most of this video discussing. This creates a genuinely distorted set of expectations, both about what should be happening physically and, more subtly, about what actually produces satisfaction and connection. Men who've internalized these unrealistic portrayals often experience a persistent, low-grade sense that something is wrong, either with themselves or their relationship, simply because their actual experience doesn't match an inaccurate template they were never given the tools to recognize as inaccurate in the first place. Understanding the real physiology, what we've discussed throughout this video, tends to resolve a significant amount of this anxiety on its own, simply by replacing an unrealistic and inaccurate mental model with an accurate one. To bring everything together practically, the depth of connection during intimacy is driven primarily by nervous system state, not physical technique. Genuine safety and unhurried presence allow the full physiological sequence to unfold as it's meant to, for both partners. Oxytocin, the neurochemical driver of the bonding sensation most people are actually chasing when they think about intimate connection, is directly amplified by exactly these conditions: safety, presence, and genuine attention, and directly suppressed by anxiety, distraction, and rushing. Communication functions as a physiological tool, not just relationship advice, by removing the uncertainty that keeps the stress response engaged. And these principles don't diminish with age. If anything, they become more central to a satisfying experience as both partners navigate the natural physiological changes that come with getting older together. None of this requires any specific technique, expertise, or effort beyond what any attentive partner is already capable of. It requires understanding what's actually happening physiologically and prioritizing presence over performance, consistently, over the long run of a relationship. So here's what I want you to walk away with. What actually creates a genuine sense of connection during intimacy isn't a specific move or technique. It's the physiological and emotional conditions you create together: patience instead of urgency, genuine presence instead of distraction, open communication instead of assumption, and emotional safety as the foundation everything else depends on. The chemistry involved, particularly oxytocin, responds directly to these conditions, and that chemistry is what actually produces the sense of deep connection so many couples are chasing without realizing what actually drives it. This isn't information most men were ever given directly, and that gap has quietly affected more relationships than almost anything else I discuss in this space. Understanding the biology behind it doesn't just improve a single encounter, it tends to reshape the entire dynamic between partners in a lasting way. If this was useful or explained something you never quite had language for before, let me know in the comments. I'd love to hear your thoughts. Subscribe if you want more honest, research-grounded conversations about men's health and relationships like this one. I'll see you in the next video.